What would you describe as the key indicators of success? What makes a difference between those organizations you see struggling with this and those who pull it all together for a successful submission?
Yeah, great question, Dan. And this is one that I have a lot of kind of passion about with regards to helping ACO clients be successful. And that is just data readiness. Really having had some time and the resources to dive into what these three measures are asking for, the data that they're asking about. Certainly, a lot of our clients are ready to dive in and start pulling the data and reporting the measures. But a few are actually even asking, are they able to collect this data on a timely basis across the ACO membership? And so that data readiness piece and that data discovery piece before diving in, I think will help ACO clients best prepare for success. So by data readiness, what do I mean by that? First of all, going around to each of the member practices and getting hands on the data that we need to both create the denominator, the claims data, the flat files, or the 837, getting those actually in hand. Oftentimes we find that members have been asked questions about can you produce, can you send us this kind of data? They feel confident they can, but when it comes down to the rubber sort of hitting the road, again, we've run into contract constraints. You don't have access, client, to pull the data from your system. You need to pay your vendor to pull this data from your system. They're going to be the delivery body or the person who's going to do the reporting. That sometimes ends up being a surprise. So really collecting data samples from all of those data sources across the EHR, making sure you have free access to your claims data, to your numerator data, whatever you can extract from both of those systems is key. And the other piece is just understanding the volumes. Do you understand how many patients are going to be pulled into these denominators? How many records you're going to review? Where your data gaps are with regards to reporting? Understanding the data needed to report these quality measures, its availability, and any gaps in that data will be key to success.
Well, great. That was quite a discussion. I take it that you then are prepared, or Mingle as a company prepared to help our clients however they wish. If they can bring the data together and then bring it to us, that's great. Or if they want us to handle the data directly from the participant and then just give them the aggregate data back, I take it we do both.
We've done a lot of work in the last year to develop a variety of project tools that are specific to this APP program. And one of them are file management tools. If clients are looking for assistance to help organize and manage and curate that data before it is passed to Mingle, to help their membership sort of better understand the nature of the data that they're sending, where there might be gaps in that data. Yep, we definitely are developing a lot of tools to help folks understand all kinds of information about the data they can send, the files they're collecting, and the timeliness of that whole process.